Good evening, good afternoon, and welcome to all of you. I'm extremely sorry. We thought of starting this at 12 p.m. and there are few patients. I could not able to come out of them. There are two sides of me. One is patients, other is students. Both of them are like left ventricle and right ventricle for me. So sometimes patients becomes the first priority, as you all understand. So I got delayed. So sorry for that. But if you are the part of the WhatsApp study group of online MBBS, the moment we are getting delayed, we will update you. So that is an advantage. Also, you'll get the quiz link by being part of the WhatsApp group. So if you want to be part of it, please text your text to 9000-868-356 to get the joining link into our WhatsApp study group. Let's make the great beginning, doctor. I hope you're all ready and waiting to fight and to win 40,000 rupees of prize. Very good to see 19 participants. So 40,000 rupees worth of online MBBS.com video library containing 3,000 video lectures, 30,000 MCQs discussed, and 953 topics revised from the 19 subjects and 65 full-scale Gran tests, 1 lakh PowerPoint slides of notes. Everything you get it for a throwaway price. So don't wait anymore. Call our helpline and subscribe today. Now let us make the great beginning, doctor. Question number 1. You need to really read the question very fast, even tomorrow's exam. A 36-year-old man is brought to the emergency department. Lethargy, weakness, and confusion. Serum sodium osmolarity are decreased. Urine osmolarity increased. What's your diagnosis? Bravo! Oh my God! Majority of you thought it as diabetes insipidus, or is it SIADH? What is your thought? So basically here, urine osmolarity is increased. That means there is no water entering into urine. So there is an antidiuresis happening here excessively. So that is the reason. A low serum osmolarity with the increased urine osmolarity is equal to SADH, which is caused as a paraneoplastic syndrome in bronchogenic carcinoma, is what you should remember. Come on. Oh my God. None of you correctly answered? Oh, I am crying. So, Dr. Murali Bharadwaz students means general medicine में तोप हो रहे हैं तलवार के तार के जैसे. You have to answer it in the tomorrow's exam when you are Dr. Murali students. None of you could not answer, doesn't matter. Let's see the next question. 4-month-old child. The mother received no prenatal care, developmentally delayed, coarse features, macroglossia, umbilical hernia. All of you, I want you to correctly answer. Oh no, 10 of you correctly answered. Absolutely. This is a classical story of the cretinism is what you should remember. Good. Carlson is on the top. Question number 3. 23-year-old, tremor, restlessness, heat intolerance, palpitation, unexplained weight loss. So what is your diagnosis and what is it to do? Absolutely, it is a classical story of Graves' disease leading to thyrotoxicosis, which is because of the thyroid stimulating antibodies. TSAPs is what you should remember. Question number 4. A palpable mass in the right lobe of the thyroid in a 45-year-old man, medullary carcinoma of the thyroid. So, what is the classical histology? Absolutely. Amyloid-laden stroma, the tumor cells are embedded, is the classical appearance. Carl is on the top. Question number 5. 34-year-old man for evaluation of hypertension, persistent hypokalemia, 3 centimeter mass in the right adrenal, and there is, yes. So obviously, primary hyperaldosteronism is due to the adrenal adenoma, which lead to excessive mineralocorticoid production, which is responsible for the salt retention, is what you need to remember. That's good. Carl, Sesha, Lily, Somesh, closely fighting. Good. The next question. 14-year-old boy, increased weakness, easy fatigability, weight loss past 3 months, and also developed nausea, vomiting, abdominal pain with hypotension with hyperpigmentation. 5 of you are correct. So, autoimmune destruction of the adrenal is called Edison. But what is the most common cause of hypoadrenalism in India? हम इस देश के वासी हैं जिस देश में टीबी बहती है. TB is the most common cause for the hypoadrenalism and adrenal destruction in India. But in West it is Edison, which presents with hypotension with hyperpigmentation. Gotcha. Now, question number 7. A tentatively female newborn, ambiguous genitalia, clitoromegaly, hyperetremia, hyperkalemia, hypotension means mineralocorticoid deficiency. So what is it because of? Excellent. Salt-losing CAH is 21 alpha hydroxylase. Only 4 of you wrongly answered. But those who wrongly answered should go back to onlinembbs.com video library and do a quick revision. Okay? That is going to be your promise. Very good. Somesh, Sesha, Lily, Chintu are on the top. Now, question number 8. Acutely ill 18-year-old female, emergency, gram-negative diplococci, hepatitis prolonged. Very good. This is a classical story of adrenal hemorrhage because of the gonococcus, which is called Waterhouse-Friderichsen syndrome, is what you should remember. Bravo. Now, question number 9. "26-year-old woman, episodic hypertension, headache, diaphoresis, palpitation." So what is that? That clinches investigation, clinching pheochromocytoma. Yes, 13 of you are right. Urinary vinyl mandelic acid. Good. Question number 10. 80-year-old 3-year-old child, diabetes, recent onset, and autopsy favors the diagnosis of what is the thing that is more characteristic of type 1 diabetes than type 2 diabetes. Oh, none of you answered. Not at all acceptable. You have to go through the today only in the general medicine type 1 versus type 2 diabetes. There's a beautiful table which is autoimmune, which is HLA associated, which is due to the insulitis. So insulitis is the characteristic feature which is a differentiator typically seen in the case of the type 1 diabetes is what you should remember. Good to see 20 online players. Please put a word, whisper, in your WhatsApp group of your classmates. So 20 players is equal to 20 medical colleges are there with me now. So please drop a line in your classmates group. Hey, I'm playing a quiz tournament on online MBBS with Dr. Murali Bharadwaz. You also join. And drop a AHA Slides link for them to join directly and play the game, even if they are away from YouTube, right? So let's go viral and make more number of people to play the game. The term comoriantis refers to, yes, the term comoriantis refers to, what does it refers to in forensic medicine? Playing quiz tournament together, dying together is comoriantis. Badhiya. Who answered this correctly? Pardu is good in dying together. And Abhi also. Very good, Abhi. Now, the next question 12. Holding the neck of the victim in the bend of the elbow is known as. Yes. What is that called as? Holding the neck of the victim is called mugging. हम बोलते ना क्या रे आजकल Harrison mugging you are mugging Gainav sir, Dattana, Shana, but mugging actually means holding the neck of the victim in the bend of the elbow. Of course, why people call mugging Harrison, Davidson, all these books, if you are carrying to the reading room, where will you carry? In the bend of your elbow, no? So that way you can remember mugging is holding the neck of the victim in the bend of the elbow. Very good. So, Carl is on the top. Question number 13. Spermin picrate crystals. So, where do you see? Spermin picrate crystals. Yes, they are seen in Barberio's test. And it is more specific test for seminal fluid compared to any of the other tests which have been mentioned is what you need to remember. Yes. Now look. Good. Only Somesh is really zooming up. Be very sure, Mohan Babu. Somesh is ready to take away your crown. Question number 14. What is the best method to prove paternity? Paternity. Easy question. Biscuit question. So, best method to prove paternity, absolutely. DNA fingerprinting any given point of time. So if you have any success scandal Swamiji who has made one of the disciples pregnant, You want to prove the sexus scandal Swamiji, DNA fingerprinting is the best test to prove the paternity is what you need to remember. Question number 15. Stomach wash can be done in poisoning due to. Yes. So what are the indications, contraindications for the gastric lavage? You should be very sure. Great. Carbolic acid. Absolutely. Carl is on the top. Good. Somesh is also tug of war with Carlson. Question number 16. Carotid arteries are torn transversely in which situation? So, carotid arteries are torn transversely. Yes. So, whenever you do judicial hanging, you will be dropping them down vertically, and that will make carotid to be torn transversely, is what you have to remember. Right. So, Abhi, Somesh is on the top. Wow, I have a feeling that today Somesh may take away 40,000 rupees worth of online MBBS.com video library subscription as a winner. Let us see. Still, the game is young. Ligature marks in case of hanging are the typical example of what? Bravo. Pressure abrasions. So once more, the difference between abrasion, laceration, and contusion, all these things, the forensic में कुछ tables are, they're always boring to study. We always think बाद में पढ़ेंगे, मगर बाद में कभी नहीं आएगा, मेरे प्यारे हैदराबादी. So अभी करना, reverse. Don't go into reverse Kabir. आज करेगा कल करेगा परसों का बरसों नहीं. Reverse actual Kabir. कल करेगा आज करेगा अब. That's what you have to be on your toes for the next 5 months to become the winner in NEET PG exam, doctor. Now, very good. Somesh is on the top, maintaining the score. Question number 18. Pinpoint hemorrhage is seen under the skin, sclera. What are they called? In asphyxial deaths. Yummy. Third spots. Only 5 of you are right. So, Somesh clean bowl. Mohan Babu moved forward. Or did he? Akshay Chintu has correctly answered. Good. Very good. Now, the next question. 19. Which is a combination? Manasvi, please join the quiz bidder. We want to see you online. This is the quiz link. You can still now join. Yeah. So, very good. Homicidal smothering versus traumatic asphyxia. Combination is bucking. So, you know that famous story in the London about the Burke brothers, the crime story. 20. So, bucking, once more, it is more or less a repeat story. No big deal. At least now you should correctly answer, all of you. Yes, very good. So 13 of you are right, smothering and traumatic asphyxia combination. Question number 21. What is wrong about relative risk? Relative risk. Yes. So basically it's a ratio, relative risk. Incidence among the exposed divided by incidence among the non-exposed into 100. It is also called risk ratio is what you need to remember. So next question. 22. What is wrong about live vaccines? Live vaccines. So, yeah. So whenever you are combining two live vaccines, they should be given either simultaneously at different sites or an interval of 3 weeks between the two vaccines. Then live vaccines usually produce a durable immunity, but not as long as the natural infection. That's the point you need to remember. And in live vaccines, generally single dose is enough. The only exception is oral polio vaccine, which needs 3 or more doses. That is the exception. Good. 7 of you are right. Good. That makes Somesh superior, you know. Question number 23. Very good to see 25 online participants. So please be part of our WhatsApp group, doctor. If you want the WhatsApp group link, please don't forget. Oh, Manashvi, you are on medicine posting, right? I'm also in medicine posting throughout my life, being MD General Medicine. So that is the reason sometimes, though our quiz is planned at 12 o'clock, I will take about 1 hour here and there. But still, thank you all for giving patience and joining the quiz. Here or there, I will definitely, little late, but I will definitely arrive and see to that it will not be a no-show, right? So, because if all my students are like a essay node in my heart, our patients are like Purkinje fibers. So, a lot of times what happens is, I need to balance between the need of my presence with my patients and students equally, right? So, but luckily this being online, it become easier for you. But shortly on August 15th, we are launching the Incus quiz tournament app. Once launched, I will give you the link. Every hourly there is a tournament, and there is a winner will get a 40,000 rupees worth of online MBBS subscription. You can keep playing, but they're not anchor driven. An anchor or a quiz master like me won't be there, but still your classmates as a group are there and you can always keep competing. And in addition to that, we will have these live anchored sessions, at least 3 to 4 sessions every day to add the required petrol and fuel to make you keep reading, right? So that's good. Validity is what extent the test accurately measures, which it purports to measure, is called validity, is what you should remember. Good. That keeps Somesh, Kaul, Pardhu also is right, Ravi right, Aksh, JD, Suhi, Sesha, a good number of you are right. Good to see Durga, Lakshmi, Ankit Bhatia and many more who are all online. Good. Now, doctor, question number 24. What is wrong about annual infection rate of the tuberculosis. You all know it is called tuberculin conversion index. Annual infection rate is a measure of the attacking force of the tuberculosis in the community. Now, in the developing countries, every 1% of the annual risk is said to correspond to 50 new cases of the smear positive pulmonary TB per year for 1 lakh general population. वो है measurement. बराबर? Now, next question, doctor. Good to see 26 players. Excellent. Now, question number 25. What is wrong about environmental factors in malaria? Yes. Environmental factors in malaria. Bravo! The vector mosquito must live for at least 10 to 12 days after an infective blood meal to become infective. That's very important. Then fluviatis is considered to be a highly anthrophilic mosquito. And the optimum temperature for the development of the plasmodium in the insect vector is between 20 to 30 degrees Celsius. पेट के अंदर कितना होना है temperature is very important to remember. And as a rule, anopheles, they are not found at altitudes above 2000 to 2500 meters. अगर आप शिमला गए, ऊटी गए, मनाली गए, आपको एनोफिलिस नहीं मिलेगा, खाली गर्लफ्रेंड मिलेगा आपको बाइट करने के लिए. So anophelines won't be available. That's the reason people go to, at least for honeymoon, to Shimla and Ooty. Easy way to remember. Okay, so now Dr. Somesh is on the top. Excellent. Only Somesh knows about anophelines so well. According to the WHO categories, category 3 of visual acuity. What do you like to call that as? So you should know what is low vision, what is blindness, etc., etc. There's a beautiful table in preventive medicine. One of the list of tables that you have to master. If you didn't, go back to the online mbbs.com video library. Very good. Lily, you are super duper. You are only right. Question number 27. General fertility rate. What is the denominator? General fertility rate. So the general fertility rate is number of live births in an area during the year divided by the median female population in the age group of reproductive age, 15 to 44 years in the same year, into 1000 will give you the general fertility rate. So total fertility rate, general fertility rate, net reproduction rate, you have to remember totally about 7 to 8 fractions, definitions of fractions. Definitely आने वाला question. Next. Good. 28. Highest saturated fatty acid content. Basically is which oil? Easy question, all of you will correctly answer. Oh, only one. भैया unsaturated नहीं है, saturated है. You got confused with unsaturated or what? Palm oil, doctor, palm oil. जल्दी मरना है तो palm oil पियो. So, oh my God, most of you did it this wrong. How come? Only Chintu beta rightly answer kiya. Badhiya. Very good. Next, question number 29. The trend of the event with the passage of the time. आपका नीट पीजी स्कोर कैसे बढ़ रहा है, नहीं तो गिर रहा है, ग्रैंड टेस्ट का स्कोर. What is the trend line called as? With the passage of time. Yes, it's called line diagram is what you should remember. Easy question. So please don't forget, in the onlinemmbbs.com video library, there is 15 hours of revision of 400 multiple choice questions on biostatistics. Excellent discussion review is available. Please go back and do a revision in the online MBBS video library. Right? Now, question number 30. So what is wrong about chi-square test? So student t-test, chi-square test, everything you should know, doctor. So for you to conduct the chi-square, the two populations you are comparing should be comparable in their composition, so homogeneous. So two groups can be compared by using the chi-square test very much, and it is a proportion. For example, 50 out of 100 are smokers here, 30 out of 100 are smokers in another population. So you are comparing proportions in chi-square test. And chi-square test tests the null hypothesis. Absolutely. So once more, what is alpha error, beta error, and when will you use the Vinconskins test, Cox correlation coefficient? All these things you have to do the revision, doctor. We have done a detailed review of 15 hours of biostatistics in online MBBS video library. So very good. Now, question number 31. Point 8. Tell me might. What is height? Point 8 under 20-point program is what? So whoever answers is super pundit in SPM. Oh, only 6 of you. Health for all. ऐसे क्वेश्चंस एग्जाम में गेस करे तो आने वाला आंसर नहीं है मेरे चिंटू. Be very sure about it. Now, question number 32. In the picture shown below, the ligature mark that you are seeing is an example of what? What kind of injury? Yes. It is an example of a pressure abrasion. Absolutely right. Super. So Carl, Somesh, Lily, Ravi, they're all doing good. And Chintu also is right. Pravalika. Then YNG, Dolly. Excellent, 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 doctor. So I want all you guys to download the Incus quiz tournament app once we launch it on August 15, and also make your friends to download. And we are going to do everyday Thambola. Every hourly there is a quiz tournament, and every hourly there are prizes to win. and make your preparation spicy. So, doctor, the number of bullets coming out of the gun. So there are basically two. So the image which is being shown is a tandem bullet. So a tandem bullet is also called piggyback bullet. So there are a pair of bullet. The base of the first bullet is touched by the nose of the second bullet and they pass. That is called tandem bullet. आप 007 movies देखा हुआ होगा ना वैसा. Very good. At least I want 30 players, doctor. जरा आपके साथियों को हमारे क्विज टूर्नामेंट के बारे में जरा टाम करे तो more number of people will join our quiz tournaments and we will have more masala fighting on the street, a good boxing show, right? So the next question, number 34. The evidence for the mode of injury shown in the photograph below can be detected by. So, yeah. So you should know the different methods by which the foot whipping, then beating, suspensions, near suffocation, dry submarine it is called as. So all these various forms of torture and how to detect it. Yeah. Question number 35. A 40-year-old charcoal burner worker is brought to emergency with lightheadedness, confusion, headache, discoloration, as you can be able to see. So, probably what is the cause of death and what do you see in the ABG analysis? So, the patient is suffering from carbon monoxide poisoning because of the bright cherry red discoloration of the skin, which you have seen. So in carbon monoxide poisoning, typically PO2 is normal and only oxygen sat values will fall down is what you have to remember. Very good. Only Mohan Babu Carlson is on the top. Question number 36. The fracture of the structure which is marked as B in the picture most commonly occurs in which condition? So you should know first of all what is that bone that you are seeing. Very good. So basically it is the hyoid bone fracture which is typically broken in the manual strangulation is what you need to remember. Good. Good to see 28 players. I want two more to say that today we had a real masala afternoon meeting. Lunchtime brunch with Dr. Murali Bharadwaz for the NEET PG. So emphysema aquosum, what is it associated with? So, good, excellent. Wet drowning, dry drowning, in which case vagus overstimulation lead to cardiac arrest. All these things you have to be 100% sure, doctor, in forensic medicine. Excellent. Carlson, Somesh, Lily, Ravi, Pardhu, JD are really maintaining. Oh, we are missing Shweta Reddy today. Okay. So, yes. Question number 38. The use of the morning after pill. Morning after pill. Where will you use it? So, up to 48 hours after an unprotected intercourse, post-coital contraception can be done. So that is the reason it is used for interception, post-coital contraception. Yes. Question number 39. So, which IUD is used under National Family Welfare Program, doctor? So, future may questions will come under National Program, Corona may, what type of mask is offered, etc., etc. A lot of Corona questions are potential to come. So, cooperative, absolutely right. Very good. Carlson, Somesh, and Lily. So the last 10 questions before we decide who is the winner of this afternoon NEET PG brunch with Dr. Murali Bharadwaz. For spacing between the pregnancies, what is the best concept here? एक pregnancy के बाद दूसरे pregnancy नक्को बाबा after some time only. So what do you want to use? IUD, absolutely. Now, oh, Mohan Babu lost it. So Somesh, Lily, Ravi, Parthu, JD, Aksh, Abhi, Sesha, Aarti, you're all doing great. Question number 41. Copper T device. What is the mechanism of action, doc? How does copper T basically function? Yes. So fundamentally, it increases the tubal motility. It acts like a foreign body and prevent the implantation of fertilized ovum. And it leads to the phagocytosis of the sperm. They're all the true statements. Very good. 42. These are all non-contraceptive protective advantages of the OCPs. Except. So OCPs have contraceptive, non-contraceptive advantages. So, yes, you should remember, if you use OCPs, there are two disadvantages. Hepatocellular adenoma, gallbladder disease, both of them can increase. Whereas 6 conditions to which OCPs provide protection. Benign breast disease like fibrocystic disease, fibroadenoma, ovarian cysts, iron deficiency anemia, pelvic inflammatory disease, ectopic pregnancy, ovarian cancer, etc., etc. There is a protection. That's what you should remember. Good. Mohan Babu once more clean bowled and Somesh is ready to take away the crown. Let us see who is the winner. 43. So, third generation IUDs. These are all advantages except great. So, long acting, low expulsion rate, high efficacy. These are all the advantages of third generation IUDs. So, very good. Now, question number 44. High rate of ectopic pregnancy Where do you see? Yes. High rate of ectopic pregnancy. Oh, come on. Most of you have missed it. Typically, it is seen with the nor plant. Now, 45. Combined OCPs, what is not a mode of action? So once more, doctor, without a question on contraception, there is no paper. So actual NEET PG paper is not for 300 questions, it is only for 299. Yes, what you should remember. Great. So they alter the endometrium, alter the cervical mucus, inhibit the ovulation. They are not ovum killing drugs directly. Great. Somesh has really scored and coming very close to Mohan Babu. Yes. This is a edge of the seat excitement to see the winner. 71-year-old retired boiler, 6-month history, worsening dyspnea. Come on. And PO2 is 64, oxygen sat is 91, clubbing, cyanosis is not there, 5 inspiratory crepitations are there. Very good. This is a classical story of asbestosis. Whoa, bravo. Somesh and Carl both answered correctly. Lily has done really good, but somehow luck is not striking in the recent questions. So, Aksh, Anonymous, Suhi, Chintu is right. Now, the last 4 questions. 49-year-old man to the emergency department, shortness of breath. She is peripherally shut down, clammy, tachycardic, pH 7.13, oxygen sat only 89, chest radiograph is being shown. It is a simple case of pulmonary edema. How can you miss it? Oh, come on, doctor. Who is that only one guy who answered it correctly? Oh my God, that is Somesh. Somesh, Jindabad. Let us see. The next 3 questions, who is going to be the winner? 48, 49, 50. A 56-year-old man presents to his GP with a 4-month history of increasing exertional dyspnea, marked clubbing of the fingernails, and auscultation, 5 inspiratory creps. Classical spirometry is shown. Only 4 of you answered correctly. It is a case of restrictive lung disease, idiopathic pulmonary fibrosis classically. Bravo, Somesh! Cycling mein aage badh gaya. Oh, very good. Question number 49. Let us see who is the winner. 57-year-old man presents to his GP. Night sweats, dyspnea, lethargy, abdominal swelling. And subsequent investigation, hemoglobin 6.4. Radiograph is being shown. So what you have is cannon ball metastasis, which are typically vascular, pulsating in nature. So that is the classical feature. Oh, Somesh did wrong. Mohan Babu did right. Oh my God. Still the jockey is running very fast. Ravi Kumar also did right. Abhi also did it correctly. Min also did it right. Badhiya. So very good. Good to see 29 players. Last question of the evening. Who is the winner? Who is the winner of Dr. Murali Bharadwaz Quiz Tournaments for NEET PG? The one and only show in the country. Always we are the first in the country, anything, wonderful things that we do. But thank you all guys because of all your support, your encouraging participation, and the bubbling enthusiasm makes us to innovate the way the learning is being imparted. So Dr. ESR 120, Jaipur में 29-year-old women with abdominal pain and diarrhea, anything but ESR 120 is the clue to say it is TB. Bravo! So much, so much, so much, so much. Excellent. And all of you who have participated in this last 1 hour of knowledge parade. So let me once more tell you all guys, the real role of a teacher is not always to teach. There are 3,000 video lectures, 30,000 MCQs classified into 953 high-yield topics, and 1 lakh PowerPoint slides, notes, everything is there in the onlineMBBS.com video library to make you winner. But what is most important? It's not about abundance of content. How much I can be able to stimulate you to read every day, perseverantly, and how much your competition can put a pressure on you in that short time to go and answer compulsively. That is what happens in the real exam. जितना भी पढ़ो, real exam गए तो वो टेंशन और एंग्जाइटी को हैंडल करना आना चाहिए. And quiz tournamenting is the best way to do that, especially when you are finding your fellow jockey is running much faster than you. You feel stimulated. Why not me? So that should be the spirit in bite-sized quizzes. 20 questions, 25 questions quizzes. We keep on playing across the day. And after the quiz tournament, you all should get doubly stimulated and then go back to the reading room, to the online MBBS video library, right? And prepare for the exams. Good luck. Once more, we will all meet in the evening with General Medicine Quiz with Dr. Murali Bharadwaz. Till then, enjoy a great afternoon of this beautiful rainy season with wonderful clouds around you. Thank you.